Welcome, welcome, everyone.
Welcome.
Thank you for joining us today
Hey.
for mental health during finals week.
It's stressful time. We need to talk about it.
Yes,
Okay.
we do. All right, we'll take the lead.
Okay. Hi, everybody. My name is Eve, and my co-host is Dr. Marybeth. Say
Hello,
hi.
hello.
Okay. And we would love to talk to you about mental health during finals week. Let's begin. As I stated before, my name is Eve. I'm an undergrad intern at Allow Health. Yay! And I am a senior at Towson University. A few of my hobbies that I like to partake in is playing guitar, drawing, I do some songwriting, and I am in the middle of writing a book. Woo!
Go Eve.
Yes. Dr. Marybeth.
All right, so my name is Dr. Marybeth Heather. I'm the CEO and Clinical Director of Allow Health. As you can see on here, I have a few things that I am interested in doing. So outside of running our group practice, I also love to go to concerts. So we have a little concert venue picture here. Recently, I saw Neo, Mario, and Mary J. Blige, and it was amazing. I am also a counselor educator, hence the little picture of our graduates here. So I definitely enjoy supporting our students. Like Eve is with me, and I have both undergrad and master students presently working with me at Allow Health. And then at the bottom here, I have a team picture of the team I presented with at the Maryland Counseling Association in Orlando this spring. And then I have a little mindfulness person here. So I'm also in the process of writing a book and really diving into some mindful prompts and helping people see mindfulness in a different way. Guess what? It's accessible, however, it does take some practice, right? We all may
Yeah,
not feel so mindful all the time.
and devotion. You need to put in a good amount of time to do it.
Yes, the hours, right? Set that time aside for you.
Yes, because you are important. Okay. Why is it important to discuss mental health during final week? It's important because of the impact on the academics itself, the emotional and physical health, excuse me, extended health concerns, value of self-care, and looking for assistance. What I mean by impact on academic health is what it can do and affect on memory, your focus, how you go about trying to remember information for school, work, and any other resources that you may need your mind for. Emotional and physical health, what I mean, how it is impacted is it increases your stress level and anxiety and even your depression through the pressure of taking your finals. Extended health may not always be long term, but can be long term for both physical and mental health, such as chronic stress, worry, panic attacks, and other mental health issues that may be neglected over time. The value of self care is by maintaining and controlling how you perceive things on a different level through finals week, making sure that you take care of you as a priority through adequate sleep, working out, maybe reading a book, writing one. As for assistance, students get a better understanding through asking for help, but sometimes people think it's not acquired or not a resource that they have at hand. It just like Dr. Marybeth. You can use support groups and counseling services. What mental health is affected by finals week in school? It increases stress and anxiety to perform well on exams, and the fear of failure increases by how many classes you've taken or need to take for exams. Depression, on the other hand, is a combination of stress, the lack of sleep, and a sense of being overwhelmed by how many tasks you need to take or accomplish. Physical health issues can manifest in physical symptoms such as headaches, fatigue, stomach problems, and some sleep deprivations. Another mental health that is affected is the amount you're eating. Sometimes individuals experience the change in increase of appetite, and others decrease in appetite, which could change how you look or perceive something. It definitely changes your.
This is that snack time, right, Eve?
Yeah. Woo.
Maybe a little
Yes.
binge eating in there. I know Nachos and I were best friends in undergrad. I was like, I'll just have some nachos, right?
Yeah. I kid you not. That is why the freshmen gained 15 pounds.
Oh,
For social,
no.
yeah, for for social isolation, most undergrad and graduate students for studying prefer to study alone, but in doing so, isolate themselves from their friends and family who could support them during this time of needing support. Another effect is on academic performance. While stress and anxiety can deprive one of remembering and gaining information, it also impacts the overall academic outcome during the exam itself because you're overthinking and overanalyzing everything. It also helps with, it also affects concentrating and decision making because it puts so much strain on your mind that it makes it hard to focus and remember things to make those decisions. One big example of what gets affected is perfectionism. People want the best grade, 100%, A plus, woohoo! But in doing so, get scared that if they don't get 100%, they automatically fail, which is not true because a 90 is still an amazing grade. With this perfectionism comes burnout because you're overusing your mind with lack of rest, not enough nutrition in your body, which could lead to mental and emotional exhaustion. Then comes sleeping problems because you're up late studying, which causes more stress, and then lack of sleep patterns, which then lead to fatigue on maybe the day that you're taking your final exams, which impact in the future as well your mental health.
I see in our chat box, Eve, our participants are agreeing with us. They're saying that sometimes people forget, like, a 90 is still really good, depending on your university, your college. I mean, that's an A minus or an A.
Yeah.
You know, that's fine.
Yeah, I don't know who's telling anybody that a 90 is bad grade. I don't know where they're
Right?
at because they're
Some
doing
people,
amazing.
some people have that slogan, C's get degrees, right? Just
Yep.
pass. Get out of there.
Yeah, right? Like the greatest minds of our
Mm-hmm.
time and even before got C's. Why? Because they were focusing on other things, like
I
Albert
will
Einstein.
say master's programs are a little different. They do require you have a B or better. So
Okay, okay.
C's get degrees. That's undergrad all the way.
Yes, 100%. What helps prevent mental health exacerbations through the finals week is making sure that sleep is a priority, because sleep is essential for both physical and mental health in anything that you do in life, not just finals week. Taking pauses, making sure that you take time for your brain to take a break. Brief pause. It doesn't have to be long. It could be like, 20 minutes, just enough time for your brain to go, okay, what did I just learn? And then go back to whatever you were doing, or move on to a different task so your brain has enough time to go, you know what? Okay, I have something else. Now I need to go back to what I was doing. Taking part in exercise. Sometimes you just need to like move around or go for a walk and then come back with a clearer headspace, because it gives you more of an opportunity to go, you know what? Self-care, I need to do this because I am more important than my finals. Consuming a well-rounded diet helps increase your mood and makes your body feel like it's full and ready to take on the day. Also decreases stress and anxiety. Good food. Yes. Looking for assistance as well within your like colleagues, classmates, family, friend who you can lean on in this time where you don't want to be isolated. Also, there are studies shown, not just one or two, there's a few studies shown that studying in groups have a better outcome on tests than just studying by yourself. That's support. That's support during this time.
And even getting those different learning styles, you'll have that overlap by studying in a group, right? So you'll get
Yeah.
both audio by hearing each other, you'll have that critical conversation, you'll be able to discuss examples, connect it to a positive experience, so it's more
Yes.
likely to be remembered, all of those things.
What also happens within study groups, that's what I meant, study groups, is if you don't know how to tackle something, somebody else might actually have the answer. And then you could use both of your brains to maybe like go, oh, well, I don't know how to do this. Do you know how to do this? No. Maybe we can like shed ideas back and forth and then go, oh, that's how you do it. And you'll get answers quicker than just doing it by yourself. What also helps prevent mental health exacerbation during finals week is being able to see where you're stressed out or you feel an anxiety and try to like control it, calm it down. If you're in the wrong space, go walk around. Also keep in mind that finals are just a brief moment. Even though it is a week, it's just a brief moment. A week is just 1 week out of 52. It's very, very small. Also, putting your well-being, even though it's really hard to think about, you are more important than any final, any job, anything. You should be prioritizing yourself. If you do not feel well enough to do anything, don't push yourself to try and do something else. Okay, so now that we have gotten all of the background information out, I want to get into the finer details. Let's delve into what is stress. Well, stress is a condition of anxiety or tension triggered by challenging circumstances that are affected not just the physical, but the mental health. And it usually comes upon behavioral and emotional, not just physical reactions that lead to anxiety disorders, panic attacks, excessive worrying, restlessness, not being able to get it out of your mind, and seeking support, not just, in family and friends, but in professionals like Dr. Marybeth or anybody who like has a degree in mental health, like social workers or therapists or anybody who has the ability to help you either calm down or manage the stress or maybe even prevent it in some cases if you see the signs, which could be heavy breathing, you know, sweating a lot, or not being able to think or feeling your heart pound out of your chest. Those are some signs of stress that people don't normally connect to because they're like, oh, yeah, it's a normal day. Like, it could just be the heat. It's not. They are connected sometimes to heat or other things around you environmentally. But seeking help early, even though you don't know the signs correctly, they could help you develop healthy coping mechanisms to maybe understand that, oh, this isn't normal. I need to maybe calm down, go for a walk, understand what's happening so you can navigate your life's challenges, not just, sit there and freak out, because that's only going to increase your stress or anxiety further. What causes stress? What are the causes? There are five main focuses: money, job pressure, health, relationships, and poor nutrition. What I mean by money, it's not just, just having money. People have debt from school, from buying a car, a house. You have to make sure that you have enough money to pay those, not just bills, making sure that you have a job to pay for them. Like, I know people who are losing their jobs every single day and they're worried, what am I going to do? I have all of this debt. So making sure that, you're secure in what you have. Job pressure. Maybe the workload you have is overbearing, or you have a conflict with a coworker or a boss. Knowing what you know in the job will definitely lower your stress levels as long as you know how to manage them. Health. When you're sick, you can't go to work, which will stress you out because then you're not making any money. Or if you get an injury, depending on where it is, like some people, if they get an injury really bad, they could lose an arm. People stress out about that. They're like, oh my God, am I going to be able to write? Am I going to be able to walk? Am I going to be able to hear, talk? It depends on the injury, but some things will stress out a person. Even if you just cut yourself, be like, oh my God, can I die? Because I know people who over think about that. With relationships, it's different. When you're stressing out of a relationship, it could be any relationship. Like, oh, well, do they still like me? They're not talking to me. I haven't talked to them in a while. Oh, did I do something wrong? And just start overthinking it. With poor nutrition, if you have a lack of essential nutrition, it could impact your mood. You could go to work and be so hungry that you just want to, go eat a cow. Like, you could be so mad. That's where hangry comes from. They're like, because you're hungry.
Or even lethargic, right? Like if you don't,
Yeah.
if you have a lot of candy or you're drinking a lot of coffee or caffeinated beverages, whether that's a tea or even energy drinks, right?
Yeah.
You can crash and burn. There's so many different chemicals in a lot of processed food and energy drinks that really just take your nutrition down.
Yeah. I had a coworker, she drank like 3 energy drinks and I could see her doing this. She was
Oh,
like,
she got the
I
shakes.
need to move. Yeah. It was scary. I was like, are you okay? You need food. And the right amount of food could put you in a place where you need to be mentally, physically, and emotionally. Now, what is anxiety? Anxiety is an uneasy feeling. It's usually for a long term, future focused, usually to a reaction to diffuse danger, but it's typically occurred when there's no intimate danger. It's most of the time when you're thinking of anxiety, it's usually problems that are created in your mind that somehow make a physical appearance. It's kind of like the same as fear, like you're fearful of something. And that fear usually is reacting to a particular threat, even though it's not there. And it significantly impacts daily function. every single day. If you're afraid or scared to a point, you could literally be bedridden all day. And if you're bedridden all day, you're not going to be able to work. You're not going to be able to go outside and enjoy the sun, or, play in the snow, or, just take a walk around the block. And it diminishes your quality of life. So, leading to avoiding behaviors and difficulty managing stress could overwhelm you. So, seeking a professional could help navigate you through all of what's driving all of these insecurities or anxiety disorders. And it's not just medication that can help. Talking to somebody improves symptoms and overall well-being. What causes anxiety is a few things. Stressful life events like trauma, seeing abuse, violence, or natural disasters like COVID. Like, we all got stuck in a house for months, not knowing what was going to happen. Stressful situations like work, school, personal relationships. Like, something happens and you don't know, and you can't fix it by yourself, and you don't know how it's going to end, but you try your best, but that causes anxiety of not knowing. Loss and grief. Having a loved one die, I know for a fact everyone in either the future or the past have felt it, and it just eats you up inside because you miss them. And that definitely increases anxiety. With anxiety, it's also genetic. You could have a family member who has anxiety disorder, parent, grandparent, even though grandparents, or the further you go back, they'll probably not voice it, but they probably do have it. Or or a sibling, or a cousin, great aunt. As long as they're within your genetic makeup, you are able or prone to be getting or to get anxiety. With brain chemistry, it's different, even though it could be genetic. You have the predisposition of an imbalance in your neurotransmitters like serotonin and dopamine, that it's not regulated on a normal basis. With
And
medical
Eve,
conditions,
there's
and
some connection
yeah,
too between trauma, genetics, and medical conditions, right? There's research out there about up to seven
yeah,
generations back, trauma can be passed down. So then you can have it more likely to have a genetic disorder or a medical condition because of a family history of trauma, right? Well, really
yeah,
specifically, there's a lot of research about Holocaust survivors and their family
yeah.
members and specific illnesses that are being, family oriented from that particular event. And it's not just that, it's seven generations. You know how
Yeah.
crazy the world was 7 generations ago? I have no idea what my seventh great grandparent was doing, but I imagine it was the hot mess express at some point. Like, well, the world was a
Yeah.
wild place. Not that it's not now.
Seven
My
generations. That was like
goodness.
1700. Ooh.
Right. People are getting, you
Mm-hmm.
know, what do we want to say? I don't know what they were doing. They're getting dragged out in town. We'll just say that. Things were happening, and they were not pleasant.
100%. With medical conditions and medications, um, they can also cause anxiety. Like, if you have a condition where it's so bad that nothing helps, you get anxiety like, oh, I don't want to die. I don't want to feel this. I don't want to have a disease where it's going to cost me the price of living. Medications can also be used to treat mental health, but it has side effects or withdrawal symptoms if you stop taking it. Because, I know from personal experience, if you stop taking your medication, it has really bad side effects. Mm-hmm. Another cause is drug and alcohol. I know most people who get together, and I haven't seen you in like a minute, will drink just an occasion, but could also if you drink too much, will cause anxiety. If you partake in marijuana or in any other drug substance that's not prescription, which could also be prescription drugs, could also cause anxiety, depending on how you're taking it. It can cause a whirlwind of anxiety and other symptoms to be exacerbated through you because your body's not normal to what you're taking. Now, other effects could be like shyness, which is based off of a personality trait, or a tendency to worry or overcome something, but you don't know the outcome. You could be more prone to anxiety. Now, most people don't think this is actually a cause, but it is. Environmental factors cause a big explosion in your brain, like violence. If you see someone carrying a gun, you're going to be like, whoa. You're not going to be like, oh, you're carrying a gun? That's nice. No. Or seeing everybody hang out and you're all alone. Social isolation will cause anxiety, being like, does no one like me anymore? There are so many different environmental stresses out there that can contribute to anxiety. What are some symptoms that come from stress and anxiety are two. There are physical and mental. Some of the physical ones are elevated heart rates, like you feel your chest like going do 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 do. Not being able to breathe, being short breath, trying to catch your breath. It's really scary. Sweating is a really big one because you're not understanding what's happening. Tension doesn't matter in the jaw, shoulder, or neck. It could be anywhere. Your foot, you just tense up. Stomach
That's mine, Eve.
problems.
I'm tension. I'm like, my shoulder will talk to me. Like, hello.
You're like, hello. Oh, hi.
What are you thinking
Oh,
about?
okay, you don't like this. Mine is stomach problems. It feels like butterflies. It's not, and it feels so bad. It just like, it's not nice. Headaches is one, even though people are just like, I got a headache. It's probably something else that you're not realizing. It could be because you're stressed out and your body's trying to tell you, be like, go away from this. It's not a good situation. Or fatigue. Like if you're tired every single day, there is a possibility that you have anxiety or stress and you're just not seeing it like everybody else is seeing it. So if you're tired every single day, it could be because you're stressing out about something. Loss or increase of appetite, as I was saying before, you could have a fluctuation in eating. And when you're stressed out, or at least when I'm stressed out and I'm overly stressed, I'm not going to eat. My husband, he's like, you better eat. I'm telling you. But sometimes the fluctuation in eating is really bad because if you don't eat for periods of time, you could go to the hospital because they'll be like, oh, you're not getting enough nutrients. Your body's not getting enough fuel to function throughout the day. Now, we are going to talk about the increases of anxiety and stress, and I want to bring it over to Dr. Marybeth, and she can help you understand it better. Ooh, nope, I forgot mental systems. Ooh, my bad. There are mental symptoms to stress and anxiety, but it's more inwards. It's tension, like Dr. Marybeth was saying, or overthinking and overanalyzing, like catastrophe. Dr. Marybeth, do you want to explain what catastrophe is? Just to the people who don't understand what it is?
Oh, we're talking about catastrophizing, making those big things up, right? So it could be something that happens that's small, and then all of a sudden, it feels like the biggest thing that ever was. Or something that is a short-term event, you feel like it's long-term. So that is just like the end of the world that something happened, when really, probably in the next 6 months to a year, that's not really going to matter, right? Is it going to matter 5 years from now? No. Then you're, catastrophizing, making it bigger than what it is. Sometimes it's that thing where you're looking in the rearview window. I think, what does it say? Objects may appear smaller or larger than they actually are. It's that kind of misperception. They're like, is this big or small? I don't understand, depending on how your vehicle is. So think about that when you're thinking about catastrophizing, that it may appear larger than it actually is.
Kind of sounds like the domino effect. Like something really teeny can lead to something really big, even though it's not. Okay.
Yeah.
Okay. Now it's the increase. My bad. I'm only human. Dr. Marybeth's going to explain the increases in anxiety and stress.
Sure. So we have here, why do stress levels increase? So it could be from the pressure. So that's self-induced pressure, or pressure from family, pressure from career goals, overall pressure from the situation. Maybe the task is feeling heavy or a lot, that it feels burdensome. All the projects. I know with my students, I'm like, all right, it's week 7. If it's week 7 out of anything, whether it's a 10-week program, an 8-week program, or a 15-week program, week 7 always feels like, what's happening? Even when you're in the middle, it's like, oh my gosh, we're here. What are we doing? The time constraints, maybe you're not feeling like you have enough time to study, enough time to do all the work. Even thinking about those ratios, how many in-class versus out-of-class hours. I know that blew my mind when I was a student. They were like, for every 1 hour you're in class, you need to have 3 or more hours of out-of-class time. I was like, I never did that in high school. You've lost your mind. It's like, this is craziness. Oh, I see comments down there said, for me, it's multiple small things piling up. It appears more of a problem than they actually are. Yes, catastrophizing. Yes, circling back. Let's see. Fear of not getting it right. So the potential that you are a failure, right? That you're not going to have the best grade. That you're going to repeat the course. When really, if you've done those steps, participated in a group study, have you done your own note cards or study skills or AI review? I know you can use that now, right? There's so much cool technology you can use to help you study. So
I know I've used it.
Use it. So you can decrease some of these fears. Impacts on your mental and physical health, right? So stress levels decrease your threshold to cope. So you're going to have your window of tolerance is going to be lower or smaller. You're going to get stressed out quicker. Mental health symptoms faster, or your physical health is going to be impacted. You're going to get that fatigue, that lower energy, maybe even get ulcers or actually get like a physical ailment in your body. And social exclusion is our last one here. So you separate yourself from others. And that's so sad. It creates loneliness and isolation from your peers and your family and that support system, that community. So why does anxiety increase during finals? So not only genetics, our environment, our psychological factors, it really has to do with our own life events, our own family, our own medical conditions, our own use of substances, whether that's drugs, alcohol, or caffeine even, because guess what? If you have a caffeine headache the day of your final, not fun. If you're missing that venti, something, I don't know. What's the fanciest Starbucks drink you can drink? I'm not a coffee drinker like that. I wouldn't even know. I guess a cappuccino.
I think it's a cappuccino.
Yeah. I don't know. I feel like it would be something big and some iced coffee these days with people. Something with froth in it, right?
They said cheese is also up there with like nicotine because you can get addicted to it too.
I bet. I love cheese. Oh, cheese is fabulous. Additional elements could also be anxiety linked to your personality traits. And, it's just maybe how you've always been. You're a worrier, right? So life events, what's tricky is they can happen at any time, right? I've had life events happen during finals, and they did impact my finals, and I had to redo some things. Sometimes that happens. You have to accept that it's happening and be okay, and use some counseling skills that we might use, like radical acceptance, right? It is what it is. We can't change the life events happening. I think one other time I had, there was the earthquake right here in Maryland, and I still had to go to class, and there was a sinkhole on my way to class. I was like, we still have class and I'm a sinkhole to drive around? Okay. I'm gonna I know, right? I was like, I'm gonna make it. Other people
I'm glad you're okay.
I was like, other people don't have a sinkhole in their neighborhood, but I still had to go, right? So I want to think about those things as you understand that life is always happening, whether it's a life event or your family background, some of your biology, your dopamine, your serotonin in your brain is impacting you. It's always going to be moving and shaking.
Some ideas for counterbalancing stress during finals are physical health, which connects to definitely getting enough sleep. I am an advocate. You better get 7 to 9 hours during this week. It will help you retain all of that information. Working out, yoga. Some people weight lift. I can't do that personally. I think I'll get crushed. But I mean, you do you. Walking around the block. Dieting, definitely. Eating the right amount of food, eating the right food, prioritizing fruits and veggies and not, energy drinks, like Dr. Marybeth said. Drinking enough water, staying hydrated so you don't, lose focus or, faint because you're not getting enough nutrition into your body. Then there are some emotional and mental assistance too. Techniques for relaxation, like yoga and meditating. Ooh, it tickles my brain when I do it. Or,
The meditation does, or the yoga?
do both. I like both.
I see in the chat box we have
definitely
yoga, gentle strength training, walking. I just did yoga this morning. It felt good. And I meditated. You all know I meditate every day. Meditate. First thing I do before I do anything.
Ooh. Breathing techniques, definitely a must. They feel so great. They ground you. They make you feel like you're in the here and now, which, by the way, we should all do. Stay in the here and now. Pauses or breaks, regular breaks for studying, definitely prevent burnout, and it gives you like a new sense of purpose. Social assistance for your emotional and physical needs. Speaking to a friend definitely boosts my well-being. Speaking to a family makes me feel seen. Talking to a therapist, somebody I connect with, or a teacher, always boosts my mental well-being because I feel seen and heard. And then talking to myself gives me that drive, that confidence, be like, yeah, you could do it. Stare yourself in the mirror and be like, yeah, you could do it. We just need to do 10 more minutes of studying, and then yeah, we can go for that walk. Woohoo! You got this. Yeah, powers me up. Does it power you up, Dr. Marybeth?
Yeah, I mean, I'll go and I'll walk with my dog after, right? And sometimes he'll even like kick me, when you get to the end of something, he'll be like, I think it's time for a break. he's like,
excuse
hello,
me time.
Excuse me. Let's do this.
Play, excuse me, my turn, my attention. Yeah, thank you.
Yes, break.
Some more counterbalance to stress and anxiety is organization. I know for me, I have anxiety and I have ADHD, not a great combination. So I write things down, and then writing things down helps me see, oh, I only have 5 things to do. And then I can compartmentalize, this needs to get done here, this needs to get done here, this here, here, here. And then you can even break it up into subsections. Like if I have to make a project and it has to be at least 20 slides, excessive amount, but I mean, it is what it is. It's school. And I can only do 10, a week. Then if I know that, then I'm going to break that week up into 2 and do 5 and 5. So I'm not overworking myself, and I can still get everything else I need to get done in my other classes. A really, really good thing that elementary school teachers do is they give stars to the students who accomplish something. They want to make them feel proud. Well, we could do that too. We could tell ourselves, yay, we did it. We can give ourselves, 5 minutes on our phone, because I know for a fact phone is addicting. So you don't want to like stay on your phone too much, but you want to give yourself a little prize. Maybe give yourself the food you really wanted forever and you haven't had a chance to. Go get that for yourself. Or, get yourself like a movie or play a game for a little bit to give yourself the acknowledgement. Yes, I achieved this. Yes, I finished it. Yes, I gave myself the determination that I wanted to do this. Other additional advice that we could do is mindfulness. Instead of worrying about the past or the future, staying in the here and now, grounded. Some hobbies definitely can help. Like I said before, I'm writing a book. I sing songs. I play the guitar. You could be like, exercise. Maybe that's a hobby for you. Or you could cook, because I know people de-stress by cooking. Hobby could be cooking. Be like, I'm gonna be there at the dinner table, be like, give me some food, thank you.
Gardening too,
Oh
painting.
yeah.
Those are ones I like.
Ooh, I like them too. I don't have a green thumb though. Every plant I have dies. But it's a really good hobby. Limiting screen time, because it gives you overstimulation, because you're like, oh, I want to be on my phone. Oh, I want to study. Oh, I want to do this. So if you limit the time that you're on your screen, any screen, whether it's a computer, TV, phone, tablet, smartwatch, because smartwatches are very distracting, especially because it's connected to your phone. You can get all the messages. You have to put that away as well. And if you take a break from technology and, like go paper writing or, memorization, if it's on note cards, try to get yourself away from overstimulated items so you can take back control of your attention. And then, oh, yeah.
I was gonna say with screen time, make sure to use those settings in your phone. Do you limit your screen time on your phone? Does it remind you if you've been on your phone for too long on social media or on a game or watching YouTube, right? You want to check that and adjust it accordingly, right? You'd be surprised, even if you put like 3 or 5 or 6 hours, you don't really want to be on that long, Even an hour a day on social media is a lot. So
Yeah.
consider that, like putting your time limits in there and reminding you. It'll let you snooze it or dismiss it if you really want. Or at least it gives you a cue to say, hey, you've been doing this a lot today. Change that blue
Yeah.
light too, right? On your phone.
Yeah. And then seeking assistance when you're afraid that you don't understand an answer. And if you're in a study group and they don't understand the answer and you've come up with so many ideas and you can't figure it out, I definitely encourage you to go to the professor or an advisor or a counselor and seek guidance on a specific question you have. Because sometimes it could be as simple as a yes or no, or it could be as complicated as a really long paper question, paper answer. I'm not saying that's usually the case; those are very rare, but it could be in any way, shape, or form to the way that you need it to be calibrated, especially your learning skill. They can't just talk it to you. Maybe they need to email it to you so you can read it, so you can see it, or they need it. Like in art, maybe they have to show it to you, and then maybe you show it to them, and they'll be like, "Are you this? Is this correct? Yes or no?" Or it's the same way. There are some methods to treat anxiety and stress. One, make a plan. Be like, this is the deadline. This is what I need to complete. And then put it accordingly. take breaks in between the planned study time. So like if you have to work on a project on Monday, well then study on Tuesday. Make Monday all about that. So, or you can break it up into hours instead of days. You do, well, I'm going to do a project for about an hour, and then I'm going to work on the paper, and then I'm going to work on studying. But in between those, I want you to take at least a 5-minute break to ground yourself and make sure that you're not overworking yourself. And it doesn't matter what you do on your break, just take a break. Just make sure that you are making sure that you're okay so you can do other things. Because if you get sick, no one's going to do your finals. No one's going to go to work for you. No one's going to do this. No one's going to do that. No, because they're not you. Just make sure that you are okay so you can accomplish other things. I really like deep breathing because it makes me feel centered. Like 3 deep breaths, like deep breaths, like you could feel it in your stomach. Then connecting with others, taking part in hobbies, even connecting with Universal Counseling Department, or because I know for a fact they're very supportive and they're there for this reason, particularly if you are feeling overwhelmed and you don't know how to do anything, they are there to help you walk through anything. And I know at the Towson, I know they give, I think, 15 free sessions for students. And then, of course, you have to start paying for it. But they're there to help you. Then, of course, joining a study group, I'm a very big advocate for it. And it helps your brain see angles that you didn't see because someone is bringing a new perspective to you that you didn't have. 100% never be afraid to ask for help in anything, work related, school related, life related. Most people need help who are very social beings. If you need help, don't feel bad to ask because I promise you, everybody has no problem helping you. They just need to know what you need help with. I know Dr. Marybeth has helped me on more than one occasion because I needed help. And she was like, I got you. I just need to know what's up because I don't know how to help you with nothing.
Happy to help. Happy to help.
Yes. I appreciate you. I appreciate you. Now, here are some tips to help you stay sane during the semester. Now, you don't have to do it all in the same order. Getting enough sleep, even taking a power nap will do you justice. I wouldn't suggest doing like really long naps, maybe less than an hour, just a power nap to give yourself rejuvenation. Staying hydrated, planning ahead and prioritizing tasks, and I mean any task, including yourself. You have to prioritize yourself. Setting a time for movement, because staying in one place will definitely make somebody very tired. So maybe in the middle of studying, you need a break, walk around, and then come back and be like, okay, I could do this again. Making sure that you're getting enough food because when you're studying, your brain goes through a lot. It needs a lot of food. Sometimes carbs, not always, but enough.
And you need
And
that food to be able to learn in class too, as you're in the semester.
Yeah. That's why I get confused when teachers are like, you can't eat during class. I'm like, well, you want us to focus. You want us to pay attention to you. You're be like, nope, can't snack. Nope. You have to wait 3 hours to eat. And I'm like, no. No, thank you. I appreciate you. I'm going to eat. Thank you. When I mean setting boundaries, I'm not just talking about like if someone's being toxic. I'm talking about setting a boundary where if you feel burnt out or you feel the burnout coming, set a boundary. Go take a break. That's a boundary you could set for yourself and you have to stick to it. Or setting a boundary like, I want to hang out with you. I really do, but I really need to finish this. So maybe instead of us hanging out today, we can hang out up to finals, putting that boundary up, making sure that your studies is a priority to you. Yoga and meditation are a lovely, lovely support system. They help out with focus and concentration and making you one with whatever you're doing. And then come back and then you'd be like, oh, I have a new point of view. Definitely distinct between work time and playtime. Now, there are differences between playtime and relaxation, because playtime you have all the time in the world, and relaxation is just trying to give yourself, a little bit of time to take a break and then come back. Or work time is you need to study, you need to prioritize what you need to do. And I am an advocate for both of them. They just have a difference in time. Just because you want to play does not mean you don't have to study. It's not how it works, because then you'll definitely fail. So you definitely want to study, prioritize work time when it's work time, and then prioritize playtime when it's playtime. Now, I do want to open up the floor to any questions that anybody has, and I will try my best to answer them as well as I can.
If we don't have any questions from the attendees, that's okay as well.
That is
We
perfectly
appreciate
okay.
you. We appreciate you joining.
Yeah.
Thanks. No questions here. It says lots of good information. Very well done. We have another comment coming in. Yes, thank you both for coming. Thank you for attending.
We appreciate everybody who has joined. Thank you for your support.
Thank you so much. That's it for us today. I'm going to end the meeting now. Thank you all.
Bye.
Bye.